ESMO 2017 finished today after 4 days of animated debates and discussions on the topics that are shaping the future of oncology. A record number of abstracts were submitted, a 13% increase on 2016. 1,736 abstracts were selected for presentations, including 55 late-breaking abstracts. 482 clinical trials were discussed in 192 sessions, with 161 Phase 3 studies. Beyond the clinic, several sessions were dedicated to economic and policy issues, as rising costs of treatments and discrepancies in accessibility of drugs compromise an equal provision of care across Europe. The aim was to make medical oncologists understand these issues, commented Paolo Casali, ESMO EU Policy Committee Chair. Our major concern is approval and reimbursement of promising treatments, which is fragmented from country to country. There are still a lot of problems, but a lack of solutions. Medical oncologists must learn to better interact with healthcare administrators and become decision makers themselves.
Many areas of advance that are really making a difference, both from new treatments for patients, giving established treatments earlier for patients, but also comparing established treatments. Is one drug better to the other? Comparing, for example, abiraterone and docetaxel in the STAMPEDE trial. An area of expanding interest and increasing interest is the importance of DNA repair defects in prostate cancer patients, particularly in their normal DNA, the DNA they're born with, and the risk of inherited cancer, risk not only of prostate cancer but other cancers, ovarian, pancreatic, leukemia. These advances are really having a major impact in allowing us to improve outcome of patients from this commonest of male cancers, to improve quality of life, and also we hope eventually to prevent cancer. We have had some exciting new data on a very new type of treatment, a treatment that actually delivers like a heat-seeking missile, a new drug that uses an antibody which targets the cancer and a radioactive chemical attached to it.
We actually had a number of important studies that was presented. One of which is called Pacific Study. It is actually a maintenance study using durvalumab, which is an anti-PD-L1 inhibitor, after concurrent chemo-ILT in patients with stage 3 non-small cell lung cancer. And the progression-free survival was hugely different compared to a placebo control. And with this, potentially, there may be a change in paradigm. Is patient after concurrent chemo-ILT, we may have to consider the use of maintenance immunotherapy. The other one is actually on the role of osimertinib, which is a third-generation EGFR TKI used in the first-line setting in comparison with the standard of care, which is gefitinib and erlotinib. Now, this is actually one of the largest first-line study comparing two TKI, and in this particular study, osimertinib was found to be superior to the standard of care in terms of progression-free survival. The median progression-free survival was actually 18.9 months compared to the standard of care approximately 10 months. Hazard ratio was significantly different, is at 0.46, and also the difference is actually improved in patients with CNS metastases. So overall, I think these two studies will actually make us to consider the change in paradigm in our practice. Of course, there's a number of other important studies coming out as well, but they will add on to whatever we have already known.
The one that will have a deeper and higher impact in clinical practice will be the study Monarch 3. Potentially, this will be a major breakthrough in the treatment of luminal advanced breast cancer. In the field of advanced breast cancer, there were also other studies presented evaluating other drugs, but still not yet ready for a change in clinical practice. In the field of early breast cancer, also important trials were presented. One of them was the ExteNET study that looked into anti-HER2 therapy with neratinib as extended adjuvant treatment, confirming a benefit for these patients. This benefit has to be balanced with the toxicity of this drug and we have to learn how to manage that toxicity. And then there were other trials that, although not yet ready for clinical practice, they looked into very promising drugs, particularly the study Lorelei that looked into the use of a PK3 inhibitor in the neoadjuvant setting. Also another trial looking into the use of CDK inhibitors in the neoadjuvant setting. So a huge accumulation of information and data that will certainly have an impact in the near future.